So this is a bilevel device. A lot of times it's called a BiPAP machine. It's a device that you use with sleep primarily. We would prescribe this type of therapy once a patient's pulmonary function tests indicate they need intervention, or if they have subjective reports of having difficulty lying flat in bed, sleeping well, morning headaches, any type of fatigue or being tired during the day. It's a device that sits on the nightstand. We have a lot of different interfaces that can go with it. One of the big misconceptions is that you always have to have a mask that completely covers your face. It might have been true 20 years ago, but today we have a lot less invasive interface options that are more comfortable for the patients. It helps keep the upper airway moist so that the patient doesn't have dry mouth, dry throat, dry nose. It makes it more comfortable and easier for them to tolerate. They put the machine on. We try to get them acclimated where they can sleep with it for the majority of the night. With ALS, the danger of hypoventilation becomes more of an issue once the diaphragm is starting to become impaired or have a reduction in its efficiency, and the patients retain carbon dioxide. So they have machines similar to this that can be used for other diagnoses, but specifically with the ALS population, you use a bilevel because you have an inspiratory pressure and an expiratory pressure. That pressure gradient is what makes it easier to tolerate, and the difference between the two pressures is what helps eliminate the carbon dioxide from the body. So we typically would recommend that they use that all night. They can wear it during the day if they want to take naps, or if they're having issues getting used to the therapy. A lot of patients will set it next to a chair, watch their favorite news program or their favorite radio station they listen to, and then they just try to get used to breathing with the device. The sooner you initiate this therapy and can get acclimated to the interface, the better it is long-term for the patient. So as they go through the different stages of disease progression, they're more prepared and able to tolerate the therapy that's really going to make a difference for them. The biggest benefit from the bilevel or the BiPAP device for the patient is that they give the respiratory system an opportunity to rest while they're sleeping, and they feel more energy and more refreshed when they wake up in the morning. So particularly if they wake up with morning headaches every day, or they get tired and they have to lay down and take a nap every day, a lot of times those issues can resolve or significantly improve once they start sleeping with the therapy.